Everyone. We want to thank everybody for joining us today. We're sorry we're a couple minutes late to let everybody in from the waiting room. We appreciate your patience. We'll go ahead and give everybody another minute to make sure we've got everybody in the meeting. Looks like we have a great turnout today, so we really appreciate everyone being with us. Okay. Looks like we've got a lot of people here, so we can go ahead and get started. Hello, everyone. I'm Beth Fisher. I'm a staff assistant in the Commissioner's Office. I help out with the department's communications efforts and assist with these forums. I've probably communicated with many of you on registrations and questions and things like that. So hello. I apologize. I'm filling in for the great Veronica Judy Cecil today, and I will just let everybody know up front, I am no substitute for the Senior Deputy Commissioner, which I'm sure you guys already know. But my colleagues and I are going to step in to share updates with you today. And I will certainly do the best I can to fill those big shoes for Veronica. So real quickly, we'll take a look at today's agenda. We are going to share just an update about the state's emergency response and Medicaid's emergency response related to flooding in the state and especially in Eastern Kentucky, and share some resources for our Medicaid members. Helen Dawson is going to give an update on renewals and eligibility. We'll talk briefly about the Anthem transition, and our colleagues from the behavioral health team are going to talk about Medicaid's reentry program. We'll also do an update on the waivers from our staff in the Division of Long-Term Services and Supports. And then we have a guest spotlight from our friends in the Department for Aging and Independent Living. Jennifer Craig from the Office of Dementia Services is going to present today and has some really great information to share with our partners. And our hot topic to close out today's forum is our Healthy Kentucky Home Update, and it's very timely. Public Health has chosen the month of February to focus on emergency preparedness. So our medical director, Dr. Judy Terrio, is going to provide some information focused on that topic at the end of the meeting. So quickly here, we just want to acknowledge the devastation in Eastern Kentucky. We know this has a tremendous impact on Medicaid members as well as the provider community, and we just want to share our heartfelt, wishes for a robust emergency response and comfort to the people in Eastern Kentucky. And we definitely encourage our members and providers who have been impacted by this disaster to reach out to us. We are sharing some resources on this slide. You'll see we have the 1915C Home and Community-Based Waiver Program. There's a hotline on this slide, as well as an email address to reach out. Should you need any services or supports, please let us know. Also, if you are a member who is enrolled in managed care, if you have questions, if you have lost your medical card, if you are having trouble accessing medical services or getting in touch with a provider, or any of those things, we encourage you to contact your MCO member services. And also, if you have questions about that are pharmacy or prescription related, we also have the pharmacy hotline on this slide as well. So as always, we post these slides on our medicaidunwinding.ky.gov website after this meeting is over. So these resources will be posted there. Please, I also urge you to follow us on social media. We are sharing resources there as well, not only from the Department for Medicaid Services, but from Governor Beshear, who has been sharing daily updates on through his channels. They're very helpful and informative, and I would encourage everybody to check those out as well. Okay, next I'm going to turn it over to Helen Dawson for the renewal update.
Thank you so much, Beth. I appreciate that intro, and I echo your sentiment that just wishing everybody is safe and healthy, and thank you for sharing those resources that are available, Beth. For the renewals, updates and just information on numbers here today, I'll be sharing some current information. You can see on the slide here, this is sort of an update on the most current look at Medicaid enrollment across the state. We anticipated with the resumption of Medicaid renewals that happened at the end of the PHE that there would be a decline in enrollment. As we worked through the renewals and processed eligibility determinations that way. So you can see this trend reflected here from the beginning of those renewals in May 2023, almost 2 years ago now. But for a long time, you can see that we've been hovering right around 1.5 million, and that has been steady across a couple months as we've transitioned to our more annual renewals and continued those cases. Okay, so if we can go on to the next slide, I want to just emphasize that we are in our normal eligibility enrollment processes at this time, which means all members are going through their typical annual renewals for eligibility determination. These have been going well, and we've really learned a lot from the resumption of renewals and leveraged a lot of flexibilities that we were allowed to have in place. A few of those to support member renewals are still in place and will be continued through June 2025. This includes continuous child coverage, which means when children are coming up for their annual renewal, the state is able to grant them 12 months of continuous coverage, automatically renewing them for another year. This will continue through June 2025 also, but starting in July, this year, those child renewals will resume, and so there will be determination of eligibility for all children across Kentucky starting again in July. The department's working on some communication materials to help with this resumption, and we'll be working with schools and community organizations and providers to make sure that everybody has the information needed to help families help children and keep as many children covered as possible. There was also a bulletin from the Centers for Medicare and Medicaid Services that came out in November last year that allowed states to make some of the flexibilities permanent. We've mentioned this before, but the department is working through consideration of these opportunities and how to make some of them more permanent. This part of this is also tied to some of the final rule pieces that the department is working to implement too, like working on those requirements. On the next slide, we can start looking at the fact that, we've been continuously reporting numbers on renewals to CMS. We report renewals each month, what happened in that month. And then after 90 days, we update the report to show how the pending cases were processed within that 90 days. So here on the slide, you can see those at a very high level. On the left-hand side, you see that in original monthly report. So for October, we submitted a report on the 8th of November by the required due date that showed what happened to members that had an October renewal. There were roughly 61,000 members that went through renewal, and Kentucky was able to approve almost 53,000 of them. There were about 1,500 Medicaid terminations, and 4 cases were pending at the time of this report. Following that 90-day period where we're able to, get more information from members, go through, making sure the cases are processed appropriately, we've submitted the updated report on those October numbers too. 3 of those pending cases were processed, as you can see, and I know that final remaining pending cases is being worked on right now, so it should be processed very soon. But when we submitted this report on the 15th of February, we had processed 3 of those pending cases, and you can see by the numbers that 2 of those were approved and 1 of those was terminated. All right. Okay, so then if we go on to the next slide, And then I see a quick question in the chat from Brian. The top reasons for terminations typically are, they're determined ineligible. We have some flexibilities in place that allow members additional time to respond to their requests to avoid procedural terminations at any cost. Procedural terminations is what we call terminations from Medicaid members that don't reply to their request for information. So there are some of those, but we've got a lot of flexibilities in place to minimize those, and we're doing intense outreach across the state to make sure members know to reply. But termination reasons, seems that there were there's people move out of the state, they are no longer income eligible. We have a couple members that pass away, and therefore their Medicaid is ended. And then I think I quickly caught the chat on the slide previously. We weren't showing that extended number, but I can talk to that here too. So this is a closer look at some of the more recent months, those current months. We track these a little bit differently because these months are still within what's called the 90-day reconsideration period, which is a flexibility that we have in place across Kentucky. This means that if a member is terminated at their renewal date, but they come back within 90 days with the requested documentation and we determine them eligible, we can reinstate their coverage back to the termination date. There's no gap in coverage. And they're reinstated back to when they lost that piece because of this 90-day reconsideration window. So these reports highlight members that are approved, terminated, pending processing, and those members that are extended. So per the question in the chat, that just the numbers, the extended numbers might be where you're seeing that difference. Those members are granted extensions of coverage due to some of the flexibilities that we have in place to allow more time for them to respond to notices. This is an effort to avoid those procedural terminations that I noted before. But you can see here on the right-hand side of this slide, we are seeing people come back within that 90-day and getting their coverage reinstated. So these change daily, the numbers evolve. And so that's what's happening a little bit behind the scenes as cases are being processed, et cetera. All of these reports are available on the Unwinding website if you're interested in looking into more of that detail too. So I encourage you to check those out, and we put them up as soon as they are submitted to CMS. So if you want to look through that, please feel free to do so. On that website, also, if we move to the next slide, we always want to remind folks that there is a lot of information there that could be useful to you. On this slide here, you'll see a couple examples of flyers that we have on the website that are available to download, print, whatever works for you in your office. If you want to hang a poster up, that is perfect. You can use these flyers to do so. They talk about, or they're aimed to help providers and members understand more about navigating the renewal process. And, thinking through what you should be aware of and be ready to act on. It also, we have things that, help members with things like ID proofing, as you can see on that final example here. That's something that has to happen for Connect accounts. And so this tip sheet is there to help members kind of think through or work through that step. So that they can be able to engage on the Connect. And, we really encourage anyone, advocates, family members, providers, connectors, community organizations, to please feel free to take these flyers, check them out on the website, take what will work for you, and use them in your day-to-day. They're still pretty applicable today. A lot of the information is good, even though it came from, during the PHE. The information on renewals is still similar because nothing really about that process changed too much. And on the next slide, I'm just going to give you a little snapshot of the website that I keep referring to. We've got that URL there on the screen. But here are a couple things up there. As I mentioned, we've got the plans, and we've got the reports up there. You can always check out. We've got a whole page of communication materials that has all those flyers and additional items. And then you can find recordings of past stakeholder meetings such as this one, or our partner meetings and forums. It also has some other plans and some general FAQs should you be interested. So I encourage anybody to check that out for some additional detail as needed. And I think that is it for the renewal slide. So I can turn it back to you, Beth. Thank you.
Thank you so much, Helen. Okay, the next topic on the agenda is the Anthem Medicaid transition. So we have a lot of participants today. We have a lot of new folks who have joined this forum. So quick background, Kentucky Medicaid terminated its contract with Anthem Medicaid Managed Care. The effective date of that termination was January 1, 2025, and all members who were enrolled in Anthem MCO were transitioned to either United Healthcare or Humana. And those members also had the option to select another MCO if they so desired. So that transition was completed as far as moving members into new managed care organizations, but there are still a number of things that are part of this transition that are ongoing and will be ongoing for a couple of years. And those are the things listed on this slide. I would also encourage everyone to, if you are interested or need more information about the Anthem transition and how it has impacted Medicaid members and some of the things that the Department for Medicaid Services has done to make this transition go smoothly. It was a very successful transition. We do have resources for our members as well as our providers who have experienced any sort of problem or issue and they need to communicate with us. We have a website or web page devoted to the Anthem transition. I will drop that link in the chat shortly for anyone who needs more information. There is a FAQ document that has just been recently updated. It has very recent information, so you're going to get a lot of information there. We also have some educational materials and flyers on there, as well as phone numbers our members and providers can use if they have specific questions about this Anthem transition. So I really encourage anyone who needs that information to check out that website. I will drop it in the chat in just a minute. Okay, and with that, I'm going to turn it over to Angela Sparrow, I believe is on the call to give us the update on the Medicaid reentry program.
Thank you, Beth. Next slide, please. Again, wanted to provide some updates around the Team Kentucky 1115 demonstration. So again, just a reminder, Kentucky did receive its extension and approval of several components under Team Kentucky in December of 2024. So Team Kentucky 1115 now consists of the out-of-state former foster care youth coverage, our substance use disorder 1115, our reentry 1115, and now again our serious mental illness 1115 and a health-related social needs 1115, and that includes a recuperative care pilot. Also, again, we did receive approval for a recovery resident support service. This will fall again under our SUD 1115 umbrella, and this again will be a service for individuals to receive supports in recovery in appropriate recovery residents. Next slide, please. Want to touch a little bit again on another initiative within Medicaid, the new provisions of the 2023 Consolidations Appropriations Act. This mandate, again, just reminder, did become effective January 1st of 2025. So this does amend our existing laws that limit Medicaid and CHIP coverage for some of our incarcerated individuals. Kentucky again did receive approval for a CAA planning grant to support implementation of the requirements again over the next 4 years. That funding, again, the notice was sent to the states, out to the states again in January, early February. This again is at hold until we work through some of those initiatives at the federal level, but more to come on that as well. Next slide, please. So in terms of the 1115 and CAA implementation and timeline, we again continue to work with our justice partners, DOC, DJJ, our sister agencies to complete design sessions around implementation of the reentry 1115 in October of this year. So again, we'll continue to have some of those design sessions, work groups, continue to carry out that planning. We also again have deliverables due to CMS in March for the new components that were approved under Team Kentucky. So additional implementation plans are due to CMS, and that is upcoming. We continue to work on that as well. We will have additional monitoring protocols, evaluation designs due to CMS as well, for the new components that were approved in December. And so our teams will continue to work on that. We will move towards for reentry implementation as we get closer to summer of this year, going through some of those system changes, readiness, preparedness with our facilities. And then again, with that implementation in October. For the new components for Team Kentucky, again, that implementation timeline is still being developed and built out through 2025. So more to come on that. And then again, just want to make a note that we'll continue in 2025 to work on onboarding our local jails and other facilities around CAA requirements and coming into full compliance with that. And I think that's all the updates we have today.
Good morning. My name is Alicia, and I'm here to give you all a waiver update today. If you don't mind, go to our next slide. So first of all, our waivers for the new rates were effective 1/1/25. So everybody does have access to those, can bill up to the max rate. We posted a public comment. The rates were updated in the current regulations that were out there. That is the only thing that was updated within those regulations. We are working for future to update all of our regulations to ensure that they correlate with the updated waiver amendments that have been approved by CMS. We did put out some additional Michelle P. waiver guidance related to respite. And then to switch over to our slots, as we said before, all the slots for state fiscal year 25 were allocated. Those were done by the end of October. Obviously, we still reconcile those frequently and release slots when we have those available. Now start 7/1 of 2025. So our fiscal year 26, we do have additional slots in our ABI long-term care, which is 25. HCB and Michelle P. waiver, there's going to be 500 additional slots in each, and then SCL with an additional 250 slots. We are working on a plan to release those after 7/1. Again, we understand that it does take time to get assessments completed, the outreach and all of that. So we won't just offload all, say, 500 slots on providers at that time. We will do it over a period of time. And we are working through the specifics of that. Just a few updates on our EVV. For PCS, the therapy system went live as of 1/1/25. So any providers who are using therapy were supposed to transition no later than 1/31. So you should have already transitioned. You should not be using NetSmart anymore. Every provider should have already, or at least worked to archive all the data in NetSmart by April the 1st. Now, there are some providers, I do understand, use a third party, so this might not affect everybody, but again, should not be using NetSmart anymore. And that switch for the state-sponsored system was moved to Thera. And go to the next slide if you don't mind. And just before I go through, I know that Beth talked about the unfortunate flooding all throughout the state, and we did release some communication from our department for individuals who are within our waiver program, our nursing facilities, home health, private duty nursing, but we have released communication for our providers, for our members. If you are needing help or assistance, please submit those, send that in. If for some reason you need assistance filling out those forms, please let us know. Call our waiver help desk. We are here for you. We will help you fill those forms out. In our communication, we also had released, if you have immediate needs that are non-life threatening in nature, we had released a number you can call. That was 502-607-6665. And they may include, your power's out, or it could be inconsistent. Maybe it's going in and out. You might not have heat or very little heat. Maybe, lacking food, or little drinking water. If you're unable to leave your house, and just, don't hesitate to give us a call. We're here for you. We are working with our other sister agencies, just making sure that we can do what we can for the people of Kentucky. So I know Kelly is putting the forms in our chat there. So again, please use those. Please call us. Again, our last page here, we do have several, even though we are the state agency, Medicaid is, and so we're responsible for all of our waivers. We do have operating agencies, work well with our sister agencies. So that's the Department for Behavioral Health and the Department for Aging and Independent Living. And so right here on this screen, we do have contacts for each of our waivers and who you should reach out to. And just one note, participant directed, even if you're in the Michelle P. waiver, participant directed is administered by the Department for Aging and Independent Living for all of our waivers. But if you need anything, again, we're here for you all. And hopefully we'll have some more updates at our next monthly call. One thing I didn't mention, we do have a renewal that's forthcoming for our home and community-based waiver in our Model 2. So just be on the lookout for further information on the release for public comment. So hopefully that's going to be coming soon. In the next slide. And I will turn it over to our partners with the Department for Aging and Independent Living.
Good afternoon. Thank you guys for letting me join you today. Advance to the next slide. My name. Okay, so my name is Jennifer Craig. I am the Office of Dementia Services Coordinator, and I am located within the Department for Aging and Independent Living. Next slide, please. So just to show what Kentucky looks like when it comes to dementia, and this consists of Alzheimer's disease, this is Lewy bodies, this is every type of dementia that you can think of. In 2020, approximately 75,000 individuals in Kentucky was living with Alzheimer's disease. That number is set to increase by 14.7% over the next 5 years. We are now currently over 80,000 individuals with a diagnosis of cognitive impairment. And this is what it looks like at the county level. So it's very important that we look at the state as a whole and just the importance of it. Again, something to always remember when you talk about dementia, these are the people with the diagnosis. There are so many people out there living with this disease that do not have a diagnosis as of yet. Next slide, please. Also, when you talk to someone living with dementia, there's usually someone standing right next to them, and that's that caregiver. So dementia in Kentucky not only affects the over 80,000 individuals living with the diagnosis, but also those caregivers in that care team that help to support them. Again, the statistics have increased 14.7%. That caregiver number has also grown In 2022, 157,000 individuals identified themselves as caregivers. They provided 302 million hours of unpaid care. And if we were to put a monetary value on that, that is $4.8 million that they provided. If anybody in here has been a caregiver or is currently a caregiver, I want to say thank you. But also to take care of yourself. Over 65% of caregivers have at least one chronic health condition. 39% have depression and 21% have poor physical health. Home health agencies and personal service agencies. In 2020, there was a little bit over 22,000 individuals working at these agencies. But with the dementia growth expected, we will also need to start working on promoting other ways to support individuals in their homes. Next slide, please. So that was a little bit of the statistics of dementia in Kentucky. Now it's why is Kentucky doing the thing and how are we doing it? So the Office of Dementia Services was formed in 2021. And that is the first time that the office was formed. It's in regulation. This is also the first time that a coordinator was hired to promote dementia services in Kentucky. So Dale, Medicaid, all of us have done things in the world of dementia, but we've never had that focus on it. And that is what my office is set to do. So in the last 3 years, we've been awarded several grants, and I'll talk to you a little bit about that. We've also pushed education requirements. So home health agencies, personal service agencies now have a requirement to provide their direct care staff some dementia education. Go on to the next slide, please. So what we're looking like in 2024 and beyond. So we have a dementia state plan. The last time that a dementia state plan was done for the state of Kentucky was in 2008. It was then kind of regurgitated in 2017. But a lot of things have changed, not only for the state of Kentucky, but also in the world of dementia in those years. So the new dementia state plan is set to be on the governor's desk by July. I do have it in draft form now, and it's being reviewed. The other thing that we're wanting to do is launch dementia friend initiatives across the state. We're also looking into expanding policy development. We'll talk a little bit about some of our bold initiatives. And then actually trying to figure out how to collect the data for individuals living with dementia and utilize that to help promote programs and services. The next slide, please. So some of the things that we're doing today, the Office of Dementia Services hosts quarterly webinars. I will put that information sheet in the chat menu for everybody to see. We also provide caregiver training. We are working with the University of Louisville Traeger Institute to offer free dementia training. We also review the dementia curriculum for all personal service agencies and home health agencies today and make sure that they meet those 6 hours of initial, 3 hours of annual dementia training. And then we also have a training resource list. Next slide, please. Now we're going to talk about some of the cool things that the Office of Dementia Services is doing. So one of the grants that we received a few years ago was through the ACL. And we are doing these things called dementia care services in 3 different regions: Pennyroyal, Bluegrass, and Buffalo Trace. There are at least one dementia care specialist in that region. That is the person that individuals can call to have all things dementia answered. They know all of the services. They know how to connect you with services. So anybody living with dementia in those 3 regions, they have that lifeline that they can reach out to. Another cool thing with the dementia care services in these regions is participants are given $5,000. $4,500 is spent on respite. $500 is spent on assistive technology. That assistive technology has helped people purchase beds. That has helped people purchase door alarms, lifeline, like life alert necklaces, anything like that that a caregiver needs to help individuals living with dementia remain in their home for as long as possible. Also, that respite services that can be provided through personal service agencies, that can be provided through adult daycares. That money is for them to find the services that they need and pay for that. The only diagnosis to be eligible for this is you have to have a cognitive impairment. So if you know anybody with dementia in those 3 regions, please reach out to the numbers, and I'll make sure I'll put this in the chat as well. We wanted this program to not have too many restrictions on the care that it can provide. So if you know anybody in that, please reach out. In the next slide. The other cool thing that's happening here with the Office of Dementia Services is it's called the BOLD grant. It's Building Our Largest Dementia Infrastructure. So this is a partnership that we have with the Department for Public Health. And this is really putting brain health and risk reduction into the world of dementia. So to make sure that individuals are taking care of their blood pressure from birth to death, so that way it doesn't lead to dementia in the future. So the first 2 years of this grant was our planning phase. This is what has helped us figure out what needed to be in the dementia state plan. The next 3 years, so starting in October, is our implementation phases. So our work groups are working to determine exactly what we're wanting to do. And then the next 3 years is actually doing the things. We have several different work groups. We have a workforce development work group, a community outreach work group, a data and evaluation work group, and a policy work group. So we'll be able to do things in each of those entities. And the next slide. I know I went through really quick. I was given 10 minutes to talk all the good things about the Office of Dementia Services. But if you have any questions, if you want to be part of it, if you know anybody who needs services or anything, please don't hesitate to reach out to me. My email address is there on the screen.
Thank you, Jennifer. That was wonderful. Well, we're going to talk about our Healthy Kentucky Home and what our emphasis is for this month. As you guys remember, our Healthy Kentucky Home is our initiative through the Cabinet for Health and Family Services to increase physical activity, improve nutritional health, and to decrease social isolation. So eat, exercise, and engage. And the month of February, our focus is on emergency preparedness. So we'll talk a little bit about, what is an emergency, how to prepare, and what our Medicaid members can do. And like Beth had said, this comes very timely because of our recent emergencies within the Commonwealth, the horrible flooding that has been going on. So next slide. Natural disasters are really increasing annually. I mean, you can just watch the news and see there's flooding, not only the floods in Kentucky, but elsewhere, wildfires, mudslides, just really bad rainstorms that cause devastation to neighborhoods, tornadoes, hurricanes, just horrible things happening. And we have to be prepared. we want our members to, kind of look at their household. How can you be best prepared for any of these things to happen? You can't help them, they're going to happen or not, but you want to be prepared. So next slide. In Kentucky, over the last 10 years, we have actually had 24 disasters declared, which is a lot, and it doesn't even count what's happened this month because these numbers stopped in December of 2024. So we've already started adding on to them. And I know you guys have either been affected by it or heard about a lot of these, the tornadoes, the floodings, even back when we had the ice storm. So again, we want you to be prepared to protect yourself and your family in case something happens. So next slide. Part of being prepared is having that wonderful family meeting. Meet with the members of the household and discuss what could happen. Is it severe weather? Is it flooding? Is it an earthquake? What could happen in your area? And then how to prepare for it. And how you respond is going to be a little bit different if it's a tornado versus a flood. But you want to have some sort of a plan before something happens. So, for example, find a safe spot in your house for each type of disaster. And we've all learned that tornadoes, you want to go into the basement. If you don't have a basement, go into an internal room without windows, such as a bathroom. So it helps really to think about things ahead of time when you're not stressed, when you're not in a fight or flight situation, and have a nice plan. You want to discuss with your family when is it appropriate to stay or when you should evacuate. That's probably one of the biggest questions that you're going to have to ask yourself. And make an emergency checklist. So you want an evacuation kit if you have to leave, but almost more importantly is your emergency checklist of what you need to bring with you if you leave, or what you need to have in the house if you have to shelter in place. So next slide. The other things you want to talk about with your family is what to do about power outages or personal injuries. If grandma falls down and breaks a hip, what are you going to do? What if it's only grandma and the 4-year-old at home? How is that going to play out? So you have to kind of think through things. Somebody in the home really should have taken a basic first aid course or CPR class. That's important for any household. It would be good to have at least one person skilled in those things. And you can look to your local fire departments, local hospitals to get those classes. Also, show family members how to turn off water, gas, or electricity in case of an emergency. Where are those main switches and when to do it? If you're having flooding, yes, you want to turn those things off, especially electricity, so you don't have an electrical disaster on your hands. Post emergency telephone numbers, emergency information such as doctors, pharmacies, medications on the refrigerator. First responders, those paramedics and firefighters and police, they are actually trained to look on your refrigerator for important medical information. Again, let's go back to grandma falls down and breaks her hip. Only a 4-year-old is there. 4-year-old knows how to dial 911, does it, but you can't really get much information out of that 4-year-old once the first responders are there. So having the list on the fridge is very helpful. That brings us to teaching children, even young children, how to call 911, how to call them, when to call them, and when not to call them. Just so, because they might be the only ones there that are capable of handling that. Another important thing is teach children the full names of their caregivers. So this is very important if the child and the parent are separated, but what if, a child is separated from their parent, the first responder says, "What's your mom's name?" And the child says, "Mom, my mom, mom's the name, I don't call her anything else, mom." So they have to know, oh, her name is Judy, not just mom. So the full name of the caregivers. Next slide, please. You also want to have household members have access to a radio for emergency information, and that's one that does not run on electricity, one that has batteries. And then when you're talking about the safety of your home, it would be wonderful to draw a floor plan of the house when you're having your family meeting and mark several escape routes per room. So a door or a window, in case there's a fire and someone is trapped in the room. And how to get out of each room. Keep family records in water and fireproof containers. Now, waterproof might just be a Ziploc bag, but you can also buy containers that are fireproof to put important information, legal documents, things like that in. Great idea to have a fire extinguisher in the kitchen, and at least in one other location in the house, such as your garage. You don't know when that's going to come in handy. And then if you have a house with more than one floor, you might need an escape ladder. So if the fire is blocking the stairs in the home, and you're upstairs or your children are upstairs, how are they going to get out? So again, all of these situations sound horrible, but if you have thought through it and discuss possibilities with your families, before the emergency happens, you have a better chance of coming out on the other end. Okay. So next slide, please. Another important thing to do is to pick one out of state and one local friend or relative for family members to call during a disaster. And sometimes it's easier to call that out of state person than the in-state person. And this is important in case you get separated. If your 11-year-old is spending the night at her friend Joni's house and there is a disaster, and you're trying to call, the local numbers are fixed, how are you going to find out if she's okay? So teach that 11-year-old, okay, call grandma who lives in Tennessee, and then you can call grandma in Tennessee to see if she's notified her, and you'll know if she's okay or not. So it's very important that kids know, other family members know who to call, so you can have a peace of mind that they're okay. So of course the kids need to know those contacts and the phone numbers. And then also pick 2 emergency meeting places, one close to your house in case of a fire and one outside of your neighborhood in case something's happened and you can't get back to your house. So you can meet up with family members. Again, assuming that maybe the phones aren't working, how are you going to get everybody back together and make sure they're safe? So have these emergency meeting places in something and something that everybody in the family knows. Next slide. Now, your emergency kit. This would be very important, but again, we talked about a checklist. So you might not have all of these things together in one place, because when we go through it, you're going to say, well, that's ridiculous, I'm not going to buy all that. But it's good to have it on a list. So if you do have to evacuate within, say, 10 minutes, you have your list and you can just go through the list, get everything and leave. So you want to assemble supplies in easy to carry containers, such as a backpack or a duffel bag, whatever you can fit in there. Water and food are 2 very important. They're probably the most important things to have in your kits. You want to assume 1 gallon of water per day. And nowadays we can go to Kroger's and we can buy a gallon of water. You can do that. You will have expiration date on the water. So you will have to look at that every 6 months to make sure nothing's expired. The other thing you want to do is have non-perishable food like canned food and a can opener in the kit. Now, I grew up in New Orleans, and this is, back in the day, you didn't buy gallons of water at the grocery store. And so one of the things my mom would do is clean one of the bathtubs really good, and then fill that up with water. And then we weren't allowed to touch it. Like, you don't touch this. And that was our drinking water when we had hurricanes and when we were cut off. So that would work too. You have to think fast. And of course, it's when you are deciding to shelter in place. Canned beans are really good as far as the canned foods go. If you're having to, if you're trapped in your house for 3 to 5 days, you're going to have enough food, and you might not have electricity and access to the stuff in the fridge. So canned proteins like canned canned beans would be good to have in your stockpile. Again, changes of clothes, rain gear, and sturdy shoes. A lot of people don't have shoes when they evacuate. That's one thing to keep on your list so you know to get it. I know that sounds silly, but it's, you know, it's good to have a list. And then blankets and sleeping bags. Those are important if you're evacuating, but also if you're staying put, because if you have to stay put, you might not have heat and you're going to really need those blankets and sleeping bags. Next slide. Your first aid kit. Again, that will have Band-Aids, bandages, ACE wraps, things like that in it. It probably also has little scissors and a little microscope if you have splinters and things like that. You know, these are pre-purchased kits you can get at any drugstore. Always good to have around. Now, your prescription medicines. Really, if you're evacuating or staying put, you have to have your prescription medicines, but you also want to have a list of all those medicines for each family member and include the name of the pharmacy. This is something good to put, again, on that refrigerator for first responders to get. If you're evacuating, that list is on the refrigerator. You just have to grab it and bring it with you. Another good thing on that list is to have your physician's names and contact information. Again, very important if you have to leave suddenly, keep all these things in the same place. So you just have to grab, you know, one packet. They might all be in a Ziploc bag. Kids' immunization records, also very important to bring with you. Some people have medical devices. You might have a wheelchair, obviously a thing that you might need to bring, but you also need to know, for example, Granny again, if she has a pacemaker, you need to know the style and serial number of that device, just in case. That can be, you know, in your Ziploc bag. Think about your infants, your elderly, or the disabled members of your family. If you have to evacuate, or even if you have to stay, you're going to need a supply of diapers, and if they're on any special foods or formulas like infant formula. Again, infant formula will expire, so you can't have, you know, a stockpile or an inventory, you know, in the back cabinet, but keep in mind you don't want to run out. So, you know, replenish those supplies before you run out, just in case you're trapped in your house for a week. So diapers and special foods. Next slide. These are just other things to think about, maybe put on your list. Good things to have, like an extra pair of glasses or an extra set of car keys. Some things you really need is flashlights, batteries. If you're evacuating, you're going to need credit cards and cash. Again, you're not going to keep that in a separate spot. Keep it on your list so you make sure you have it when you leave. And then, of course, our cell phone chargers or charging cords for anything electronic. You're going to need that on your list. Next slide. If you are sheltering in place, your emergency kit or your evacuation kit is going to be perfect to stay in place. If you're in place, like think about today, assume there's no heat, there's no AC, there's no water. And so you're going to need blankets, you're going to need the food, you're going to need, you know, things like that. So assume 3 to 5 days on your own for your supplies to last. And next slide. I hope this was really good. Again, this is our Healthy Kentucky Home. You can go to that website and they have more information about disaster preparedness there. I see some people have added things to the, thank you, April, for adding things to the chat. And very important fire safety. And so you can never be too careful when you're the one in charge of keeping your family safe. So thank you very much.
Hey, thank you so much, Dr. Terrio, for that great presentation. It's full of so many important tips, especially now. So important right now, and important to keep in mind all year round. So again, thank you to everyone who joined us today. We had close to 300 participants today. I think that might be a record for this forum. So we just really want to send a thank you to our Medicaid community, our provider partners, our members who join us for these meetings, people from the advocacy community, our MCO partners, and of course, our Cabinet for Health and Family Services sister agencies who join us for these forums every month. To all of our presenters who share great information, we really appreciate it. We hope that the information we shared was of value to everyone who joined. We really appreciate all of your questions. We hope that we were able to get to all of them in the comments. If not, we will certainly follow up, and we'll also use that to inform future agenda topics. And with that, if you have suggestions or there are things that we have not covered in these forums and you would like for us to address, by all means, let us know. We love hearing from you. It actually is of great help when we are planning these every month. So please never hesitate to suggest a topic or ask a question. We want to be able to connect and communicate with you, and that's why we host these forums every month. So thank you, and I hope everyone is staying safe and warm, and we hope to see you next month.